Gonorrhea and chlamydia. What is an STD? An STD is a shortened way to say sexually transmitted disease. An STD is an infection that is spread from person to person through intimate sexual contact, including oral sex, anal or butthole sex, and vaginal sex. STDs are very common. What is chlamydia? Chlamydia is a common type of sexually transmitted disease that can infect both men and women. It can cause serious permanent damage to a man and a woman's ability to father or have a baby. What is gonorrhea? Gonorrhea is another common type of sexually transmitted disease that can affect both men and women. It can cause infections in your penis, vagina, anus, butthole, and throat. Signs and symptoms. Sometimes there are no signs that you have an infection, so you could have gonorrhea or chlamydia and not even know. Make sure you get tested. Signs and symptoms can differ from men and women. Signs and symptoms for men: a burning with urination, a white, yellow, or green discharge or pus from the penis, painful or swollen testicles or balls. Signs and symptoms for women: symptoms can be similar to bladder or vaginal infections, pain or burning when you pee, increase in vaginal discharge or pus, vaginal bleeding in between periods, lower belly pain. What happens if I do not get treated? Rectal or butthole signs and symptoms: discharge or pus coming from the butthole, itching, soreness, bleeding, painful pooping. What can happen to men and women who are not treated? Untreated gonorrhea and chlamydia can cause serious and permanent health problems. They can also spread to your blood or joints, which can be life-threatening. Gonorrhea and chlamydia may also increase your chances of getting or giving HIV, the virus that causes AIDS. What can happen to men who are not treated? In men, gonorrhea and chlamydia can cause pain, inability to father a child, and fever. What can happen to women who are not treated? Pelvic inflammatory disease, or PID, which is when the infection spreads to other areas of your body, such as your stomach and womb, causing pain. Gonorrhea and chlamydia can also cause an inability to get pregnant. Prevention and transmission. Anyone who has sex can get chlamydia or gonorrhea through unprotected vaginal, anal, butthole, or oral sex. If you are sexually active, ask your healthcare provider whether you should be tested for chlamydia, gonorrhea, or other STDs. How can I lower my risk? Reduce your number of sex partners. Make sure you and your partner have been tested and cleared of STDs. Have safe sex. This means you and your partner use a new condom every single time you have any type of sex. Ask your doctor to explain how you can be sure to practice safe sex. Talk openly with your doctor about your sexual history and getting tested for STDs. What is safe sex? Always use a condom or an oral dam during vaginal sex, anal, butthole sex, and oral sex. Check your partner's mouth, anus, butthole, or genitalia, vagina or penis. Does it smell different than normal? Are there any sores on or around the mouth, anus, butthole, or genitalia, vagina, or penis? Is there discharge or pus coming from your partner's penis, vagina, or butt? If you see or smell anything unusual, do not have sex with that person. Here are some images that teach you how to use male condoms, female condoms, and oral dams. If you'd like to learn more about one of these helpful tools for safe sex, pause the video to view and read the diagrams, or go to the CDC website. What does not prevent gonorrhea or chlamydia? Washing your genitals, sexual body parts, douching, peeing after sex. Testing. Testing for an STD is simple and will not cause pain. All you have to do is pee in a cup for the clinic to test. Sometimes your nurse practitioner might need to look at your penis, mouth, vagina, or anus to help them determine if you have an STD. Treatment. You and your partner can be tested and treated without anyone else knowing at the clinic. Tell your doctor about current medication and allergies to medications. Take all of the antibiotics prescribed even when you start to feel better. Wait 7 days after finishing all medications before having sex. If you have had medications for gonorrhea or chlamydia in the past, you can still get infected again. If your symptoms continue for more than a few days after taking medication, return to the clinic. What should my sexual partner do? If you have gonorrhea or chlamydia, your partner should be tested and treated as well. Avoid having sex with all sexual partners until 7 days after you and all partners have completed antibiotic treatment. If your partner is not tested and treated, they could give gonorrhea or chlamydia to you again, even if you have been treated. Remember, gonorrhea and chlamydia can harm your body. It is important to have safe sex if you are having sex. Sometimes there are no signs or symptoms of gonorrhea or chlamydia, so get tested. If you have gonorrhea or chlamydia, tell your partners to get tested and treated and take all of your antibiotics. Don't have sex until 7 days after finishing all medications. Ask your provider if you have any questions or concerns. It can sometimes be embarrassing to talk about sex, but your provider only wants to help you. Check out the CDC website for more information.